Hi, I'm Ryan Nutter with Cornerstone Senior Advisors, and each day I walk people through the process of Medicare, helping them find the right plan to fit their needs at the right price. And today I'm going to be discussing with you Medicare Advantage plans versus Medicare Supplement plans. When you go on Medicare, you're going to have a couple of different options, a couple of different routes you can take. You can stay with traditional Medicare and get a Medicare Supplement plan, which basically fills the gaps of Medicare. It's going to pick up where Medicare leaves off. Or you could go with a Medicare Advantage plan if there's an Advantage plan that's available in your area. I'm going to start out talking about Medicare Advantage plans, and the reason I say if there's one in your area is these are network plans. So they vary based on state, they vary based on county. So you're going to have to look and see, are there Medicare Advantage plans in your area, and what do the benefits look like? And one of the important things to understand and look into when you're trying to decide on a Medicare Advantage plan, since they are networks, is does your primary care doctor take the company you're looking into? Does your primary care doctor take that plan? Does your specialist take the plan? Does your hospital, if you're admitted to a hospital, do they take this plan? Network is really important to understand, and the size of network, and make sure all your bases are covered. Basically, any health professional that you may end up going to, you're going to want to make sure that they take this Advantage plan that you're looking into. Now, one of the big advantages with Medicare Advantage plans that a lot of people like is they are less to no premium. Oftentimes, they are zero premium. That's really appealing with these Medicare Advantage plans, is they're really inexpensive, they're really manageable. If they do offer a premium, it's oftentimes pretty minimal and very manageable. That's a big appeal with these Medicare Advantage plans. Now, because they're less out of pocket, you do have a little bit more out of pocket exposure than you do with these Medicare Supplement plans. You're going to pay as you go. You're typically always going to have a copay. You see a health professional, you're going to have some out of pocket costs. Sometimes they're going to have deductibles on them, so they may have a $1,000 deductible. It's going to work more like typical insurance you may have been used to when you're on a group health insurance plan or under 65 health insurance. You may have a deductible. Every time you see a health professional, you're going to have some out of pocket. You end up hospitalized, you're going to pay a certain amount each day that you're in the hospital for the first 5 or 6 days, depending on the plan. So you do have some out-of-pocket exposure on these plans, but a benefit with these plans is they always have a max out-of-pocket. So you're only going to pay a certain amount. Now the max out-of-pocket can vary. It may be $4,000, $4,500. It could be $6,000, $6,500. But there's always going to be a cap as far as how much you may end up spending out-of-pocket if you end up having some health issues in a year. So they have some out-of-pocket exposure, but there are some added benefits. This is another aspect of Medicare Advantage plans that a lot of people like, is they may cover dental. A lot of them cover vision. A lot of them include drug coverage on the plan. So instead of getting a separate standalone drug plan, you can have your drug coverage built into the Medicare Advantage plan. So now anytime you go to a healthcare professional or a pharmacy, you use the same card. That's a benefit a lot of people like. But you get dental sometimes you get vision, sometimes you get hearing. A lot of these plans offer gym memberships. You get a silver sneakers card, you have free access to the YMCA. That's a big perk that a lot of people like. So that's kind of an overview, just a bird's eye view at Medicare Advantage plans and how they operate. Now, Medicare Supplement plans are different, and we're going to look at the differences between the two plans. One, you do have to pay a premium for these plans. So you're going to pay an added premium, maybe $100 a month, $115 a month. It just depends on your area, your state, male, female, all of that can play into what premium looks like, also what plan you're going to go with. I'm going to use the Plan G as an example while I explain these Medicare Supplement plans and the out-of-pocket costs associated with them. The Plan G from January 1, 2020 up till now has just been the most popular supplemental plan out there. It's the most comprehensive plan out there, so I'm going to use that in this example. But you're going to pay, if you end up with a Medicare Supplement Plan G, you're going to pay an added premium for that plan. But there's no network. So over here you've got the network. Over here, anywhere in the U.S. that takes Medicare, any health professional, hospital, doctor, emergency room, any healthcare facility that takes Medicare is going to take this Medicare Supplement plan. If you travel a lot, people that travel quite a bit or may spend a month in a different state in a year, this is really the better option and what they end up going with oftentimes because there's no network. You don't have to worry about a network. Now, there's less out-of-pocket exposure with a supplement than there is over here. You are paying the added premium, but there's less out-of-pocket exposure. So if we look at a Plan G with Medicare, you're talking about, as of 2020, your deductible is $198. That's it. So you pay the first $198 in a year. Once that's been paid, you go to your primary care doctor, specialist, emergency room, you have an outpatient surgery, any of that, all you're going to get is a statement of benefits paid. If you end up hospitalized, you're not going to have the out-of-pocket costs in the hospital that you're going to have over here. So you save the premium here, you pay more premium here, but you have less out-of-pocket exposure. So it's really dynamite coverage. Now, another thing to understand about these supplemental plans is they're standardized. The benefits have been, so if you get a Plan G, it doesn't matter what company you get that Plan G with, it's a Plan G. The government designed that plan. So you could get that Plan G from Company Y or Company Z or Company X. It's all a Plan G. They're all going to perform the way the government designed that plan to perform. They're going to pay how it was designed to pay, cover how it was designed to pay, and cover how it was designed to cover. But a thing to understand about these supplemental plans is year to year they're not changing. There has been a couple of plans the government has gotten rid of, a couple of Medicare supplement plans that are no longer available to new Medicare beneficiaries. But anybody that was already on them, they kept those plans. They still have the same coverage. So this coverage with these Medicare supplement plans, it doesn't change. It's going to be constant. It's going to be steady. That's not the case over here. These are moving targets. Okay, so the Advantage plans and the co-pays and what doctors take them, that can vary year to year. How well your medications are covered on the drug coverage, that can change year to year with these Advantage plans. That's not the case over here. It's really, really standardized and benefits are unchanging. Now, with the supplemental plan, you're paying the added premium up here, but you're also going to have to get an added drug plan. The drug coverage with supplemental plans is not included. So you're going to have to get a separate standalone drug plan to make sure your medications are covered, which is going to be another premium. So if you're paying $100 a month for your Plan G, and then you get another drug plan for $20 a month, you're paying $120 a month for this coverage. Whereas over here, you could save $120 a month, but it's going to be more of a pay-as-you-go, and you have some more out-of-pocket exposure. So this is really a bird's eye view at just the differences in the two plans. And you're really going to just want to study the Advantage plans if you're interested in this route to see what's available in your area and what does the coverage look like. This is something we can help you with, and we would love to do it. You can call us at 316-260-3331. We can dialogue with you about the Advantage plans in your area, what the coverage looks like. We can compare that to Medicare supplement plans, what's the premium for those supplemental plans in your area, what companies offer these plans. We can walk with you through all of that process. If you'll call us at 316-260-3331. I hope you found this video beneficial for you and helpful for you, and thank you for watching.